Welcome to Building Healthy, Equitable Communities, a training series from ChangeLab Solutions. This is a virtual space to explore the elements of a just community and the conditions that will help all children and families thrive. Back in April, we began releasing collaborative episodes which offer training and discussions on how policy plus community power can advance health equity. You can see the full schedule in our 6-episode topics here or on our series homepage. Our kickoff episode explored health equity as a principle and a practice and set a high-level theoretical framework for how to use law and policy to advance health equity. In subsequent episodes, we laid out legal and policy opportunities for operationalizing health equity, including paid family and sick leave, equitable procurement policies, comprehensive long-range planning, and place-based strategies and restorative practices in schools. All of these episodes are now up for your viewing on our website. The link is on the screen. Today we are here for our final episode, Building Healthy, Equitable Communities Through Community-Driven Solutions. And just like the previous episodes, this episode will be posted on our website, so you can come back to view the slides we will present today in case you miss anything. If you're wondering what exactly is an episode, let's recap. Each episode contains 3 things. First, we publish a blog post which shares the consequences of laws and policies that don't take health equity into account and how we can respond. In today's episode, we looked at effective strategies that local governments can use to promote community engagement and public participation in 4 key government functions. Then we host a webinar that provides both on-the-ground stories and innovations from community health leaders, as well as resources to support your work in healthy change making. Finally, we close each episode by moderating an interactive expert panel. The webinar and expert panel are usually separate live trainings, but for this episode, we've decided to do things a little bit differently. Today's all-in-one webinar and expert panel will begin with a traditional webinar presentation, but for the last 30 minutes, our speakers will engage one another in dialogue as well as respond to your questions in real time. With that, please make sure to submit your questions as they come up in the chat box on your screen, and we will pose them to our panel. So you can put a face to the voice. My name is Tina Ewan. I'm a Senior Planner at ChangeLab Solutions, working at the intersection of public health, urban planning, and sustainability. I focus on mobility and transportation issues here at the lab, as well as our community engagement and people-centered work, multi-sector collaborations, and advancing healthy, sustainable, and just communities through policy and systems change. I have a background in environmental health and land use, and over the past several years I've worked on a range of topics with communities across the country related to healthy community design, active transportation, assessments and evaluation, climate change and sustainability, environmental justice, and health and all policies. On today's webinar, I'll be joined first by Xavier Morales, who is the Executive Director of the Praxis Project, a national organization dedicated to supporting communities building power for health. Xavier has 20 years of experience in community-based advocacy and research. Through the Praxis Project's flagship project, Communities Creating Healthy Environments, he teams with over 200 frontline grassroots organizations working on issues to advance health justice. Then I'll be joined by Chris Chittum, who is the Director of Roanoke's Department of Planning, Building, and Development. During his 25 years with the City of Roanoke, he has served in multiple planning roles that focus on urban design, comprehensive planning, neighborhood planning, development codes, program implementation, and citizen engagement. Invest Health team members in Roanoke have been working with ChangeLab Solutions to develop a healthy community element for Roanoke's comprehensive plan and embed community health and all policies in policymaking. I'm excited that we get to all gain insights and lessons learned from Xavier and Chris's experiences doing innovative work. So a quick disclaimer, ChangeLab Solutions does not enter into attorney-client relationships, and none of this presentation is legal advice. We are very happy to have you all here with us for this webinar. In today's webinar, we're going to talk about how collaborating with communities and building community power can strengthen law and policy solutions that support a just and vital and thriving community. We will also explore how communities and local governments are increasing inclusive civic engagement in public decisions. I will start by providing some level setting while I will discuss the importance of civic engagement, what it is, and how communities chronically underserved and marginalized are often left out of public discussions. Next, I'll introduce and describe an Equity First framework for increasing public participation and give examples of cities striving towards this ideal. After my presentation, we will hear from Xavier Morales from the Praxis Project, where he will discuss their work with grassroots organizers to build community power to improve health and social justice. Then Chris Chittum with the City of Roanoke's Department of Planning, Building, and Development will present on their efforts to improve community engagement around the city's comprehensive plan update. Afterwards, we will engage in a discussion and answer your questions, so please don't forget to put your questions into the chat box. Finally, I will close with some concluding thoughts and resources for future reading. First up, I will discuss what civic engagement is, its importance to our political system, and how civic engagement impacts health and equity. So let's jump in. Democracy requires public participation and community engagement to engender a government of the people, by the people, for the people. Civic engagement is the bedrock of a healthy, equitable community. I think it would be helpful to define civic engagement here for our discussion. The Kirwan Institute has defined civic engagement as the practices, principles, and socioeconomic conditions that comprise the environment in which people interact with their community and come together to make and implement community decisions that provide justice and opportunity for all community members. Civic engagement is the foundation of access to opportunities and justice. There's an urgent need in our current splintered political discourse for people to be more, not less, engaged in community conversations and discussions. Public participation is central to our democratic form of government, but in practice, people experiencing marginalization and inequities are often left out. This inequitable distribution of power and influence on public decisions has been manufactured, and we can and should do more to better uphold the values of democracy and equal representation in our government. In an ideal democratic process, the voices of everyone are heard and responded to. Inequitable access to meaningful civic engagement can lead to inequitable participation and thus to unjust investments, neighborhood conditions, and health outcomes. In this webinar, we aim to unearth, reveal, and dig into what local governments and communities are and can be doing to ensure more inclusive and equitable civic engagement. We all know that civic engagement is important for civil society, but what you may be wondering is how civic engagement matters for health and equity. Civic engagement can impact health and equity in significant ways by impacting people and processes, shaping how policies are developed and how they work, and by affecting institutions and systems. I'll go through each of these a little bit more in depth. Civic engagement impacts people and processes. When government processes are fair, transparent, and inclusive, people benefit. Research is showing us that self-determination and autonomy are important factors in making people healthier by giving people more control over their own lives and allowing them a say in the things that matter to them and their communities. Civic engagement strategies can prioritize the participation of communities experiencing marginalization in order to focus on addressing health and social inequities. These communities include, but are not limited to, lower income communities, people of color, returning citizens, youth, recent immigrants and refugees, and communities facing environmental injustices. I will refer to these communities for the purpose of this webinar as priority communities. Civic engagement also impacts the policies and decisions that can affect community health. By centering on the needs and challenges of priority communities, new perspectives and insights from people who have been traditionally left out of these conversations can make community decisions, like laws and policies, better by ensuring that they are informed by the people who will be impacted by those decisions. They can be designed to reflect community priorities and equitably distribute the drivers of good health, such as where public transportation is located, or investments in neighborhood parks, schools, or affordable housing. All of these things can have huge impacts on the health and well-being of the community by impacting access to and availability of opportunities, resources, and services. Civic engagement also has the opportunity to impact health by producing long-term changes to the systems, structures, and institutions that can make community decisions. Civic engagement of priority communities can help to alter power dynamics and affect government processes and practices that create sustainable changes that lead to improved policy outcomes and support continued engagement. With a greater commitment to intentionally increasing equity in their community engagement efforts, governments are in a better position to address social and health inequities and promote access to resources, services, and programs that help people lead healthier lives. Now I'd like to provide an overview of how unfair and unjust civic engagement practices can produce harmful outcomes and lead to more social inequities. I'll then introduce the concept of inclusive civic engagement. Many of you are attending this webinar because you value community engagement and strive to foster just and healthy communities, and also recognize the role that governments play in shaping the places where we live, work, play, and learn through the adoption and implementation of its laws and policies. We know from previous discussions on the Building Healthy, Equitable Communities Series, social policies and laws have systematically and overwhelmingly benefited and continue to benefit a narrow slice of the population, and that there are vast disparities in wealth and opportunities in this country by race, place, and income levels. For example, families of color will soon make up a majority of the population, but most continue to fall behind whites in building wealth. These graphs from the Urban Institute show that in 1963, the average wealth of white families was $121,000 higher than the average wealth of non-white families. By 2016, that difference is over $700,000 compared to the average wealth of African American families and of Latino families. Put another way, white family wealth was 7 times greater than African American family wealth and 5 times greater than Latino family wealth in 2016. This disparity is as high or higher than it was in 1963. The wealth gap is getting worse, not better. New data from Opportunity Insights in the U.S. Census show that factors shape economic upwards mobility and opportunities. Overall, rates of upwards income mobility have fallen sharply over the past 50 years, but there are also differences in trends at the neighborhood level. What this data reinforces for us is that neighborhoods matter in shaping children's opportunities and their life outcomes. And social mobility varies widely across cities and across neighborhoods within cities in the U.S., even in areas within close proximity to each other. For example, in our neighborhood of the Uptown District in Oakland, California, a child born to low-income parents will make on average an income of $27,000 as an adult. This is compared to a low-income child growing up just a few miles away in Piedmont, where the average household income as an adult is more than twice that of a child raised in Oakland's Uptown, $55,000. What is it about these two neighborhoods that can so drastically change the life course of low-income children that grow up within their boundaries? The answer is that children's opportunities are shaped by neighborhood conditions and access to opportunities, resources, and services that are the result of laws, policies, and investments. These outcomes are due to a multitude of reasons, one of which is the lack of inclusive civic engagement that ensures that people most affected and most marginalized have a say in the decisions that impact their lives. For example, public hearings, one common method that government agencies use to obtain public input on decisions, tend to attract only the usual suspects. Overall attendance is generally low, and people who are able to attend are often disproportionately white and affluent. A recent study from Boston University of almost 100 public meetings in the Boston metro area showed that white people account for 95% of participants, whereas they only account for 80% of the population. The researchers concluded that whites overwhelmingly dominate meetings discussing zoning and planning compared to their Latino and African American counterparts. But why does this matter? This matters because who participates in these discussions shape what government values, who they are responsive to, and the decisions government ultimately makes. A more equitable civic engagement process can work to ensure that governments are working for everyone and are equity focused. So what can we do differently to have more robust engagement that will generate more equitable outcomes? In order to address some of these issues, I want to introduce and discuss inclusive civic engagement. For the purpose of this webinar, I'm defining inclusive civic engagement as the policies, practices, systems, institutions, and conditions that support and ensure that priority communities, the communities experiencing marginalization and inequities, come together to influence and implement community decisions that produce health and equity for everyone. And inclusive civic engagement encompasses community engagement and public participation activities with a focus on priority communities. But you may be wondering why focus on making it easier for priority communities to participate. As Angela Glover Blackwell from PolicyLink appropriately articulates, get it right for an elite few, get it right for an elite few. Get it right for the most vulnerable, get it right for everyone. By getting civic engagement right for the most vulnerable and impacted of our society, we make it easier and more comfortable for everyone to participate and have their voices heard in the process. The result? Improved participation, informed decisions, and better outcomes. Inclusive civic engagement also includes building institutional readiness of government entities. This includes building staff capacity to engage priority communities, to be more responsive to community concerns, and to act with urgency. This could include trainings on trauma-informed practices and racial equity. It is also about learning power sharing strategies for how public decisions can be made in partnership with the community. Building community readiness to participate in civic engagement is also an important aspect. This includes building community resilience to cope with setbacks, building community capacity to understand and participate in and respond to community decisions. It's also about building community leadership. And it's also about building community power to influence public policies and laws and other decisions. And this is all nested within a supportive ecosystem that enables inclusive civic engagement to occur, which includes policies, practices, and changes in cultural norms. I wanted to wrap up my presentation with a couple of inspiring examples of cities working towards this ideal of inclusive civic engagement. Over the past several years, the City of Baltimore's Planning Department has been hosting a planning academy to connect residents to the planning department, resources, and each other. Baltimore is a city of neighborhoods, nearly 300, that have their own rich histories, cultures, and relationships to the planning process. These planning academies were born out of the need for the planning department to build trust, improve community engagement, and increase resident understanding of the planning process, the roles of planners, and how residents can get involved and inform planning decisions. Residents of communities who have faced historic disinvestment in Baltimore are especially welcomed and encouraged to participate. Over 6 weeks, the residents learn about a wide variety of topics, including the history of inequity, zoning, the development process, and operating budgets. This is a great example of a local government investing in building community capacity and readiness to engage in community decisions. In the City of Portland, the planning process related to updating their comprehensive plan led to changes in who participated in these conversations that ultimately shaped how the plan was developed and implemented. In the lead up to the comprehensive plan update, the city produced the Portland Plan, which is the city's vision. This plan articulates a vision for equity and discusses the city's responsibility for accomplishing this vision. The city also acknowledged that gentrification exists and that actions taken by the city contributed. During the planning process for the 2035 Comprehensive Plan update, discussions of developments and physical infrastructure across the city led to community organizers showing up at Planning Commission meetings. As a result of this advocacy, community groups were invited into the planning process, and the results speak for themselves. There were several policy wins focused on equity both in Portland and at the state level, such as overturning restrictions on inclusionary zoning, passage of inclusionary zoning in Portland, inclusion of anti-displacement policies in the comprehensive plan, and improved community benefits, such as a local hire policy and development fees for affordable housing. None of this would have been possible if the city was not willing and able to acknowledge the importance of equity and their role in addressing historical harms. This would also not have been possible without community groups' willingness to advocate for their interests and for their ability to work with the planning department to create equity-first strategies. Now I'll turn it over to Xavier to discuss the work he and his organization are doing to build community power for health. I'll hand it over to you now, Xavier.
Thank you, Tina. So first, just want to thank ChangeLab and my fellow panelists for all the work that's gone into bringing this webinar today. For my presentation, I'm advancing my slides. For my presentation, I just really want to focus on, you're supposed to think in threes, but I don't know, my points kind of blur, so I'm thinking in 5 today. So I want to build on the case for authentic community engagement. I also want to think, how do we think beyond our Rolodex, our established Rolodex for partners, the usual suspects for partnerships. I want to make the case that community-based organizers are actually doing public health work and other civic engagement work, and having their participation only makes our initiatives better. I'm going to provide a quick example from the City of Berkeley and the sugar-sweetened beverage tax that was enriched by community participation. And lastly, I'm going to end with kind of like a rules of engagement for authentically engaging with community groups, community organizers especially. So it's a bit ambitious. I only have 15 minutes, and I just used 5 minutes talking about what I'm going to talk about. So the Praxis Project, just an overview for us, what we do is we do basically 3 things. We create space for grassroots organizations to share strategies on building community power to improve health and justice, health and social justice. We also work with national traditional partners in the public health space to try to make the argument that we will never get truly to health equity and health justice without these authentic partnerships with community organizations. And I'll lay out the case for that in a second. And we also, working with community organizers and community-based organizations, it's a nuance. There's a lot of nuances. And unless we understand some of those nuances, we can come in and instead we may not get maximum benefit from the collaborations, especially at first, unless we understand a little bit about each other. And so what Praxis also does is try to collect information that can help to bridge these partnerships to make them more authentic. I want to start with just making the case right here. If you go to the Center for Disease Control and Prevention website and you look at the 10 great public health successes for the 20th century, this is what comes up right here. And it's awesome. This field has created some awesome achievements protecting the nation's health, in general. But if you go into every single one of these, you drill down and you look at the progress that's been made by communities, especially in communities of color and communities with high rates of high levels of disinvestment, you see huge disparities, not unlike the income slides that Tina was showing earlier. And part of the argument that we make is that if we continue to do things as we've been doing them, it kind of will reinforce the outcomes that we have, and it can actually exacerbate these inequities. This is also similar to Tina's slide, except it's not an income projection. It's actually life expectancy projection. So the life expectancy on the left side right here is out of Stockton, California. A child born in this zip code in Stockton, California is expected to live 73 years, whereas the child on the right, born in Newport Beach, California, is expected, actually that might be Palo Alto, is expected to live 88 years. And we see the same exact dynamic happening where the Praxis Oakland office is. We are located in Fruitvale in the flats of Oakland. Life expectancy here is 72, whereas if we drive just a half mile up the hill, life expectancy jumps to 88. And so, we ask ourselves, what causes this? And I'm going to pop up 2 slides. And, this is called the social determinants of health. So folks that have a public health background will understand that if these ingredients that are on this sheet right here are robustly present in an area, that life expectancy will be longer, and that health and wellness will be more achievable, or will be more present. And ARTIMIS doesn't have race and identity as a separate determinants, because we feel that the race and identity are actually embedded, and ability as well, are actually embedded in every single one of these determinants, and because of past bias and present bias, that has determined how robustly present or absent each of these are. A second thing that I'd like to make, and I know a lot of people have a problem with this metaphor right here on equality versus equity versus justice. And there's some other really good slides that have come out that kind of also get at this. But the reason I like this slide right here is that far right panel called justice. So equality, starting at the left, means everyone gets the same intervention. But what we realize is that actually the people are different, and they need different interventions. So thankfully we've been moving as a field towards equity, where let's provide the supports that are needed according to the person's needs. But in reality, and this was actually made clear to me by some of our organizing folks, that it's not just the individuals. We shouldn't just be focusing on the individuals, because the actual environment in which people are coming from are different. The terrain's different. The barriers are different. So, the terrain is not level. The barrier is not level. Individuals themselves all require different things. It's not all the same. And so this part really has hit home with me. And I'll give you guys one quick example. We were contacted by a very good partner of ours, a national level partner, that wanted me to engage our network to help reduce heart disease and stroke. And their approach was, can you activate your groups to help us get trans fats out of one of the major national chains, to get them to stop using trans fats. And while this makes a lot of sense that for the majority population that may actually help to reduce heart disease and strokes, when I start talking to my community members who are mostly coming from communities of color and communities with high levels of disinvestment, we start talking about the stress that causes heart disease and stroke, and we talk about what causes the stress. And for us, the root causes of these things are, housing insecurity, food insecurity, economic insecurity, all areas that they work on a day-to-day basis to try to improve for health. Partnerships between government and traditional fields and communities are beautiful, and they are very powerful. And so one exercise that we just did a couple of days ago with the public health group in Hawaii was trying to expand the idea of who else could be present at the table, who else could we reach out to help us with this initiative that they had going on health. And so what we did is there was about 60 people in the room. We split them up into, I think it was like 11 different tables, and we assigned them, multiples of these determinants, and we asked them to answer the question, and I'll just use food justice at the very top as the example. In food justice, what needs to be present in order to advance health equity and health justice? What are the strategies that need to be present? And so we had folks take a first crack at looking at, okay, well, we need to make fresh fruits and vegetables more accessible for families with lower incomes. That was one strategy. Another strategy was we need to improve accessibility so for example, healthy beverages become the easy beverage. And so the second level of analysis we did on this, after all of the groups came up with their strategies for each of the determinants, and some of these determinants were more centrally located to the topic that we were trying to move, and some were further away. But it was interesting to see just even the ones that were further away, the strategies that folks were able to come up with. So then the next level that we did was we said, okay, who in the community, what groups in the community are actually working on this? Who's working on trying to make fruits and vegetables more accessible for families with lower incomes? And they had to list the group or groups. Who's trying to improve water accessibility so the healthy beverage becomes the easy beverage? They listed a number of groups. And so quickly through this exercise, what we found was, one, there's some non-traditional partners that have a direct stake in the outcome that we're trying to achieve. And so through this exercise, not only were we able to identify folks, we were also able to identify the framing by which we could try to bring them to the table. So again, partnerships, be powerful and beautiful. And as was mentioned earlier, we do have about 200 groups in our Rolodex, our Praxis Rolodex, 200 groups, multi-ethnic, multiracial, multi-ability, urban, rural, from across the country. And we organize them into these 4 different buckets. And we provide them with opportunities for them to come and learn from each other, and also to receive trainings on other areas that they request from us. And what we also just did is we did a survey to find out what policies are you moving at the local level. And this is what we found, that across our groups, across these 4 different buckets, we found that the majority of our groups are working on some aspect of housing justice. Many are working on education justice, civic participation, community safety, immigration climate. So they're working to improve the conditions at the local level, to help to improve health and also to protect people. But the interesting thing here is where the community is starting from is a little bit different from where I think traditional fields start from. So, for example, if I drill down into education justice, and I don't have this slide to share, I didn't include it, but I'll tell you what education justice was. They are interested in identities that are valued and welcomed. They're interested in safety within the schools, especially in the immigration period. They're also interested in safety in the schools with respect to some of the youth of color, especially being targeted by some of the unjust discipline that's going on, increasing the school-to-prison pipeline. So they're actively engaging in that. And also, healthcare access, clinics within the schools, food policies, and even worrying about or working on providing housing for homeless students, or helping to alleviate that issue. So they really are working on issues that are central to health and better environment. This last example, I'm going to do this relatively quick because I'm out of time. I'm really very close on time. I just want to talk about how engaging with community actually makes what you're trying to do better. Because when you engage with community, the context for the work that you're doing is much more relevant to the community and will likely yield better results. So, for example, in Berkeley, we in 2014 wanted to pass a soda tax. And the reason to do that was because we were losing a USDA grant that funded cooking and gardening programs in the schools. And our leadership had gone and talked to a couple of cities that had just failed to pass the tax, and the advice from those two cities, Richmond, California, and also El Monte, California, was, you really need to bring those groups that the industry will wedge. You need to bring them to the table and make sure that they're bought in. And so they brought me in representing the Latino community, and another a person named Dr. Vicki Alexander also came in, and she's a pediatrician in their own outright, just an incredible person, but also a member of the African American community. And so as we sat there and we worked with the initial goal, what we realized is that, we didn't want 100% of these taxes to go, or these revenues to go into cooking and gardening programs. We actually wanted to see some of that money get directly invested into community programming, to support community programming for to help educate our community and help make the healthy choice the easier choice. So the next slide is actually the way we actually were able to change the strategy. So the initial strategy, and I call this the public health perfect. They said that if you really want to reduce consumption of sugary drinks, you need to increase the price by 2 cents per ounce, that the tax needs to be dedicated. You have to say specifically where the tax is going to go. And this means something in California, because as a dedicated tax, you have to win by 2/3. It has to be a retail tax. We want folks to feel the price at the register so that they know they're paying more. And this is really focused on raising prices to curb demand and consumption of these drinks. And success was if the soda price increased, and that in turn resulted in decreased purchases. But when we got together and we had more diverse folks at the table, we started to think about, okay, the perfect has not passed 30 times. What will work in Berkeley? And what we found was, we have an appetite for 1 cent per ounce. That was still going to raise $1.5 million, which in our little city, that's a lot. We wanted it to be, we didn't want the threshold to be 66%. We wanted it to be 50% because our initial polling showed that we had 66% approval, but once the beverage industry came in, we thought that would erode. And we thought, let's go with 50% because that's more defensible, it's more likely for us. And what we'll do to let the voters know that the money will go to where we say it's going to go, we'll convene a panel of experts. And again, that was something that was very localized. Then the next thing we decided is we wanted the excise tax to be paid by the distributors. We wanted the largest corporations in the world to be paying this tax. That we felt that, and we were focused more on generating the revenue to address the complex roots of disease. And success for us is defined by increased community knowledge and behavior changes of folks that are receiving the benefits of the investment. So for us, the price increase was ancillary. We really wanted to fund investment in the community, and this is how we actually were able to get at one of the biggest arguments that industry has on regressivity. So, this is I actually have about an hour and a half, 2-hour presentation on this, and I try to cut it down to 3 minutes. And one last thing I'd like to point out is, as we try to go and work with community organizers especially, and community organizations, one, it's important to understand the difference between a community-based organization that is located in the community versus a community-based organization that actually has a base in the community. The organizations that have bases in the community, they have youth leadership programs, community leadership programs. They do surveys. They find out what's important in the community, and that's what they organize around. They use these issues to build power and to help shape the environments that they live in. And so I'll just leave you guys with these principles. You can Google or search, internet search on this. They give you a little bit better background. But, when you're considering working with grassroots organizers, here's some general principles. So one, be inclusive, emphasize bottom-up organizing, let people speak for themselves, work together in solidarity and mutuality, build just relationships amongst each other, and a commitment to self-transformation. Because when you engage with communities that are the front line bearing the brunt of inequity, you will have a completely different perspective. And I'm gonna stop there. Thank you all for the time.
Thank you so much, Javier. Now I'm going to turn it over to Chris for him to discuss their engagement efforts related to updating Roanoke's comprehensive plan. Please take it away, Chris.
Okay, thank you, Tina. Just to give people a little bit of context, Roanoke, we're a city of about 100,000 people in the Blue Ridge Mountains of southwestern Virginia. We have a downtown, and some of our neighborhoods are really thriving, and we have other neighborhoods that are not. So we're working on some of those issues. We do have persisting segregation and distrust from the legacy of urban renewal. Every time I'm working in a community of color, it does come up. So it's something that we openly talk about, but it can really be a barrier to developing trust and engagement with some of those communities. We're coming off of what I would call a very successful run with a comprehensive plan we adopted back in 2001. Probably had about 80% of the ideas in that plan implemented, and we're working on a complete rewrite at this point, and have really been trying to be intentional about how we engage the public with that process. Just kind of referring back to the discussion in the blog that goes along with this series, the voting and public hearings and referendums and whatnot are often the official ways of citizen engagement. They're very common. They're the most common, and they really tend to be the least meaningful. Certainly, elections can be impactful and sometimes even disruptive, but the things like public hearings are often just going through the motions and checking a box. But a lot of local governments I've seen rely on those types of things for their only means of interaction, which needs improvement. And we know that the voices of people who show up at public hearings are those who are willing and able to show up and speak in front of a large group of people, which obviously doesn't cover your entire demographic. And with these methods, hearings, votings, and referendums, the communication is really one way, and we really don't get to have any exploration of the reason people have certain views, and so really can't extrapolate or make meaning out of some of those decisions. So that takes us into legislation and budgeting. I've always felt that there needs to be some engagement in the budgeting process, because if you really look at budgeting, that's an expression of any organization's true priorities. Really, any organization, if you really want to find out what that organization deems to be important, look at the budget. That being said, it's very difficult to have participatory budgeting because budgets are so complex and so voluminous, just the amount of material. The processes, the content are all difficult for public professionals to absorb, much less citizens with a limited amount of time and limited exposure. So it's difficult to wade through all those details. And the same goes for legislation. The amendments or new laws, they're written by lawyers. They're very complex. It's difficult to distill out what the meaning is and what the effect would be. But once you think about it, legislation is often the implementation of a policy. It should be one of the products of engagement. So with both legislation and budgeting, it's difficult to get people engaged and maintain that engagement meaningfully over time. But if you do try that, you probably need to have some benefit of an interpreter of sorts to attach meaning and communicate the choices that need to be made. So, but if you're really working in a linear fashion, you really need to be able to link legislation and a budget back to a plan that you've adopted, which brings us to planning, city planning. And I've always felt that with my experience in different arenas, Planning's one of the best places for engagement. You get to have two-way communication that promotes really understanding the why people have for feeling a certain way, believing a certain way. And it's really powerful because citizens have an opportunity to place issues on the agenda for discussion. The opportunity to set the agenda is very powerful. So what you put on the table for discussion, in other words, like rental property maintenance or zoning or a fire station or a school, getting to actually talk about that is pretty powerful because it can be stifled or promoted depending on what people are willing to talk about. And moving through the process, citizens can have an opportunity to propose interventions if they feel that the future condition is not desirable. So they can propose interventions. You have the benefit of many different ideas that are thrown on the table, and then finally they can be also involved in evaluating those interventions as they are proposed, and kind of giving us an idea and feedback of whether it would work or not. So I think one of the powerful things is that it helps us as planners and policymakers make sure that we're working on the right problems to begin with. Another one of the more powerful things is the scalability with planning. You can go in and work with subgroups and sub-areas when it's advantageous to do so. You could disaggregate data so it's easier to understand the differences and inequities between areas, and you can really customize solutions. We do a lot of planning in Roanoke at the neighborhood level, and every square inch of the city is covered by some neighborhood plan. That gives us the opportunity to talk about the details of unique neighborhood issues and future land use. And it's difficult to have, it's really difficult to have a discussion with citizens about land use patterns for 40 square miles of a city, but I can have a conversation about land use at the neighborhood level, like what do you want to see on that corner there or this street. An intensive engagement process can also elongate if you need it if you need more time to deliberate. If you've got an outstanding issue at the end of your what I'll call the standard process, and you need to work a little more on resolving some issues to get to some solutions that people can live with. So what we've tried to do in Roanoke outside of the formal planning process is really try to build an infrastructure for engagement. And we have, like many communities, we have a network of neighborhood organizations that cover about 2/3 of the city's territory. We've had that in place pretty much since the late 1980s, and have had about 23 to 30 groups throughout that time. It's remained remarkably stable. We work with them on capacity building through leadership development, neighborhood improvement projects, and we always have had neighborhood services staff that acts as a kind of a friend in City Hall and serves as a conduit for communicating issues and advocating neighborhood interests. All that's really set up to build relationships and build them when you don't necessarily need them, so that's pretty powerful way to start to develop trust, and you're starting at square one when you need to start discussing an issue with a neighborhood or a community group. Matter of fact, I mean, when we have land use decisions come up on for rezonings and such, and if there is a neighborhood that will be affected, we always send the developer to the neighborhood group to have discussion. So because we feel like the public hearing is not the forum to be talking about the details of a development proposal that should have happened a long time ago. So the public hearing really doesn't give any opportunity for the developer or the neighborhood group to respond. It's really kind of an airing of grievances situation. So Another way we try to cultivate informed citizens and engaged citizens is three things. Leadership College, I think a lot of communities have this. Earlier we talked about a planning academy in Baltimore. These are all really designed to get people on what I'll call a level playing field with a staff or the experts, so that we're not still talking about process and not still talking about the basics when we have a more complex issue to wrestle with on the table. Another thing we do is we really work hard to get citizens onto our boards and commissions, like the Planning Commission and Board of Zoning Appeals and Fair Housing Board and so on and so forth. Those have, tended to be occupied by realtors and professionals of some ilk, and but we've tried really hard to make sure that citizens are engaged through those through leadership on some of those bodies. When it comes to your neighborhood groups, they do have some limitations. Each of our neighborhood groups has a different personality, but pretty universally the demographic tends to be retired people with lots of spare time. Others tend to be out busy living their lives or trying to survive. So that's you kind of have to work with what you get. Not all parts of the city are covered by neighborhood groups, so we have some places that are just not represented, and some groups are just simply more active than others. Some go dormant when there's no issue to rally around, but and others have evolved into actually being a housing development corporation. And then you also have varying ability as far as leadership development, and we have some groups that have a president for life, and others that cycle leadership through pretty quickly. And so our job is to try to keep them engaged constantly to the extent that we can, so we maintain that infrastructure. And we don't limit our engagement to that, but that's one tool in our toolbox. When it comes to how we are looking at engagement going forward, we're finding it more and more difficult to get people out to the traditional meetings that we've had for planning, and so we started to look at more creative ways to get people engaged by going out to where they already are. We have a list of all the events that happen throughout the year, and we try to get out to a lot of those. And when we do meetings, we tend to do multiple versions of the same meeting in different locations at different times of the day, and in different locations. And so we've also transitioned to a drop-in meeting format. So going back to the desire we have for two-way communication, when we're not giving a presentation, we're actually having an engagement one-on-one with a citizen and a planner. That allows us to get down to the, again, why people feel a certain way. And we also use survey tools a lot now. There are a few canned ones out there, software programs like Bang the Table and MetroQuest that are popular, but we basically rely on just more traditional SurveyMonkey type of survey tools. But we use them often. We try to make them small surveys and do them frequently. And we've also done our planroanoke.org website. So I like to call that a rogue website, where we've developed a brand for planning and something that might live on far past our comprehensive plan. And that allows us a lot of flexibility that a civic website generally does not. Another thing we try to do is capture email addresses. They are really valuable to us in getting the word out, to pushing the word out about things that we've got going on, development proposals that are on the table, and such. So that helps us a lot. Another thing that we're looking at, since we had a public deliberation experience, is paying people for spending a day with us, and basically going through a public deliberation process where we spend first half of the day presenting data and trying to get people, again, up on a level playing field. So, excuse me, so that they are as knowledgeable as we are about the situation. So we posed a question regarding the next neighborhood we would target with CDBG funds, and it was a pretty heavy question and a lot on the table in terms of resources going to a particular neighborhood. So we did, because we were occupying them for a full day, we decided to pay them for that experience. So just to wrap up, I think really the planning stage is the best place to engage people, certainly not to the exclusion of other venues, but the planning stage is really a great place to do that. We do recommend using a lot of different approaches to try to reach different populations, and especially the ones that go underrepresented because, again, they're living their lives or trying to survive. We need to be more mindful of that. We need to keep it relevant and do it over and over again, so there are multiple. If you miss them once, you can probably pick up on them in the future. And finally, build those relationships before you need to tap into them. We feel that's kind of building the infrastructure for engagement in your city. So that concludes my formal presentation. I think we're going back to Tina at this point.
Yes, thank you so much, Chris. And thank you, Javier, for your inspiring presentations. I really loved how you left it off with build relationships before you need them. And I just wanted to take the next few moments to summarize what we just heard from the three of us. And one is that inclusive civic engagement of priority communities requires government commitments to the goals of equity and justice. I think we heard that through each of our presentations. A strong health justice frame is needed that is intersectoral. Javier talked about how it's not just about individual topics like food or parks or housing, but how race, identity, and justice connect with each of these topics and how there is a common thread throughout those topics. And I loved how Chris talked about building community infrastructure for engagement and how processes like planning can be windows of opportunity for local governments to exercise their muscles around improving community engagement. And now we're going to move into our interactive panel portion of the webinar. In case you haven't done one of these yet, let's quickly touch on the format before we get started. We sourced questions for today's conversation from you all through the blog and the registration page for today's virtual training, as well as throughout this webinar. So thanks to all of you who have engaged us thus far. Javier, Chris, and I will now dedicate the next 30 minutes or so to addressing issues you all are grappling with as it relates to community-driven solutions and civic engagement. If you have more questions that arise during the panel, please feel free to enter them into the chat function on your screen, and we'll do our best to try and answer them. All right, so let's turn our attention to some questions that came in through the registration page. Lots of great questions came in from you all, and thanks again for your participation. Some themes came up from the questions, and so I just wanted to jump in right away. And I think one of the themes that came up was how do folks who work in local government, how do they deal with resistance from leadership on the importance of community engagement through their work? So the question is, how can communities promote community engagement efforts when government agencies and elected officials may not share the same values or viewpoints, have not behaved fairly in the past, or actively resistant to such efforts? And so I will ask Chris if you want to first respond to that, and then Xavier, you can jump in if you want.
Okay, thanks, Tina. Yeah, what a question. And that's a difficult one that starts to tread into being perhaps an ethical issue. I know many of the people that are involved in this webinar are planners and probably certified planners, and we talk about in our code of ethics involving underrepresented voices and underrepresented populations, and that just being part of how we do things. I've been very fortunate in the places where I've worked and that's why I've stayed in the places I've worked, is because we have a culture of that's just the way we do things. But I think that I have, of course, run into resistance, perhaps from coworkers or other departments and things like that. I think one strategy is to appeal to the fact that it is more likely, involving the public in the decision is more likely to help with implementation and support going forward. Ultimately, in a lot of cases, it can actually shorten the process because you don't have to work through a lot of resistance. We've certainly had that experience. And I think probably the most powerful one, if you're dealing with an elected official that kind of isn't on board, you can appeal to democratic principles. I mean, I think ultimately community engagement is one of the most pure forms of the democratic process that is probably the most meaningful and touches people most directly with decisions that are made at the local level especially. So I think kind of appealing to higher ideals and trying to figure out how it may benefit them. Ultimately, if you are unsuccessful, as we talk about in the planning profession, it may be time to move on to another organization that does have those values embedded.
Thank you, Chris.
Javier. That was a great response, Chris. I'm an urban planner as well by training, and I recognize those ethics and those values. But the reality is, and it's awesome that I really think that that's the majority. But the reality is that on the ground sometimes that's not the case, especially with the in some development situations. It's not the case. It becomes contentious, and if anything, it's folks are seen as barriers to getting something that someone that has very powerful interests wants to see done. The communities get in the way, and so in those extreme situations, I like to think of them as extreme situations, but it just depends on where you're at. Sometimes this is more the norm than it is extreme. I think it's folks use lawsuits. When I say folks, for me that's a metaphor. They can use the power of lawsuits to slow something down or stop something. They can also use their ballot, exactly like you were saying earlier. If this is something about the elected officials that are in place, they can organize and try to get those the folks that are not responsive, out. But I think I didn't. There's an example that I had from Tempe that I didn't use in my presentation. That was a very direct urban planning example where the city of Tempe wanted to redevelop, or they were going to redevelop the downtown, and they were hosting these charrettes. And the city staff was incredible because they really wanted as much input as they could get from diverse communities. And they noticed that there were some long-term Latino residents, families that were descended from the original founders of the city of Tempe that weren't participating, that were still local. And so, they did a lot of work to try to figure out what was causing this. And what they found out was that there were three things. Well, the first one was that the city had pretty much done whatever they wanted to do with their neighborhoods, like in three different occasions where they came in and just basically condemned the whole neighborhood for some development. And they'd done that three different times to the same folks. And, it is kind of like they kind of lost hope and any sense of efficacy. So they felt like it didn't matter if they participated or not. The second reason that they didn't participate was because they felt like they did not know enough. They didn't understand the language that was being spoken. They didn't know what a pocket park was, a strategic overlay plan, a transportation overlay, a comprehensive plan. All of this was foreign to them. And it wasn't that they didn't understand English, but, as lay folks, it's kind of hard to understand the jargon in our field. And then the last reason that they weren't participating was because if they, by chance, they did come, because, they built up a good relationship with the planning staff, and they finally said, okay, I'll come, and they showed up. They felt like outsiders. They, felt like they, especially if it's a series of meetings that folks have talked to each other before, they really felt like outsiders. So being an outsider, not understanding the jargon and the language, and then feeling like you don't have any power, that's a lot to overcome. And, to the City of Tempe's credit, they engaged after that in a 2-year process where they kind of did one of these citizen leadership academies where they met and explained and brought folks up to speed. And, towards the end there, after a couple of years, these folks were really getting involved in a number of different issues. And, in fact, I think they may have even run a couple of people for office. So, that's just the power of there's legacy issues that cities have to deal with, that current staff that weren't there for those issues have to deal with. But, it's the power of relationships and respect that can help get to the other side on these issues.
Thank you both for your responses to that question. I'm wondering too, Xavier, you spoke about trust and relationships in your response just now, and I'm just wondering if you have any thoughts about how to build trust and relationships over time, and especially in the fact that a lot of local governments have limited resources and funds. Like what strategies or practices or activities have you found have been successful in doing that? I think you mentioned a few, but I don't know if you wanted to add anything.
Well, the one I just mentioned, and that building those long-term relationships are important. But here's the most important thing with communities, especially, is we don't just go to them when we need something. We need to interact. We need to make it part of the way we do business that we should be out at their meetings, not because we need something or we need to tell them something, but we should be participating in the community meetings just as a matter of fact, just going out and being there. I call it in the between times, because we come out when we need something. We need their approval. We just come out when we need something, and that really that doesn't help when you're trying to build a trusting relationship. And so showing up. Well, this is a line. Showing up when you don't need anything kind of shows them that you actually care about them and their livelihood and their wellness and well-being, and that goes a long way, in addition to the more formal things that we talked about. And I love the piece about paying folks. Everything that Praxis does, if we ever bring in community organizers or community folks, we always pay them just like we pay our attorneys that we bring in, our accountants that we bring in, because usually when we're bringing them in because of some expertise that they have or some assistance that we need from them. And, we want them to feel valued, just like everyone else around the table that's getting paid. They should be getting paid as well. So I really like that Chris included that as well. But that's, it's the relationship side for me.
Yeah. Chris, did you want to add anything?
I think that Javier just nailed it. Going out to neighborhood community meetings when you don't have anything to share, or you're not asking for anything, you're just going out there to be there, because you're interested in what they're up to. I think that is extremely powerful. Again, establishing the relationship before you need it, and it really goes a long way, I think.
Awesome, thank you. Javier, I wanted to go back and sort of touch on something that you had mentioned earlier, a little bit about the difference between community-based organizations that are based in neighborhoods versus grassroots community organizing groups that build a base within a community. And you made a distinction between those groups, which I agree with you. And I'm just wondering, have you seen really great examples of where local governments have worked with grassroots community organizing groups? And what did that look like, and what strategies and actions did local governments do to engage with these groups?
You know, it's interesting because a lot of these groups are multi-issue, and so on one hand, they may be working in close partnership with certain city staff and certain elected, but on the other hand, they may be trying to protect local interests that they feel are being traded away, and so they may, with another whole set of folks, they may have a little bit more of a contentious relationship. I'm trying to think very specifically. We have a number of groups that engage in food security projects. So, urban farms, and they not only do an urban farm, but they also involve the youth, where they bring in youth. They do youth development, entrepreneurial training, and are able to market these fruits and vegetables to local institutions. And I'm actually describing a group called Acta Non Verba here in Oakland. And they take the revenues and they develop these college accounts for kids, the 529 accounts for these youth. And so, on the one hand, they're working very closely with a number of different city staff and other traditional professional staff, and they're working in close partnership with schools, and they've been able to do some very good things. Now, this group is also interested in community safety, and so on that side, there is some contentiousness. Just in needing more, needing to feel safe in their neighborhood, and so those relationships aren't always as smooth as say the other side. So I think that would be like one of the, just because one side of a municipality or a city government or county government is having a very difficult time doesn't mean that if you aren't part of them, that you will have a difficult time. You just have to go, and they have to feel that you are interested in community health, that your heart's in the right place, and that you share values, and their doors will still be open for you, even if they're having problems with other parts of the city.
Thank you. Now I'm going to ask a question that was put into the chat box, and this question is directed towards Chris. What have you seen come from having developers go to communities when they want to build? Do you have a concrete example of when communities were asked for communities asked for certain things in order for developers to move forward, and the community were granted those things? And I'm wondering if they're talking about community benefit agreements and if you've worked with those.
I have not worked with those, but we have two recent examples of apartments, buildings that were proposed by developers in 2 separate locations. We're telling the developer you need to go kind of gauge and take the temperature of the surrounding community, and they did. Sometimes they don't come back. I think they get the feedback they need from the neighborhood and go work on a different project somewhere. That has certainly happened recently on an infill project and the developer has gone back to the drawing board based on what the surrounding neighbors told them they'd like to see in the neighborhood. And usually, when you have that kind of interaction, nobody ends up getting everything that they initially wanted, but often you're going to get faster to something that people can live with, I think faster, or the decision is made that I can't make a go of it, and they just kind of walk away. We have where you have a developer that is kind of arrogant and doesn't want to listen to the surrounding community. Their projects are on thin ice with our city council and with our planning commission. If indeed they have valid concerns that need to be listened to first and foremost, but responded to. So that's something that when things get to our planning commission and to our city council, the question does arise of what kind of engagement did the applicant have with the surrounding neighborhood, and why are all these people showing up at this public hearing. So I think that does indeed factor into decisions, and we can tell developers with a great deal of confidence that they need to go do this, and this is part of your process. And it's our way of doing things. It's not a special program, and we don't pick on one developer versus another, but if they're anywhere close to a neighborhood setting, we send them to go talk to that community and hear people out.
Hey, Tina, can I add here? So one of the best
Absolutely.
things that I saw in Tempe, again, when I was working with this group, was that, after about 1.5 years of meeting, and, the city staff actually working through and walking them through just like all this jargon and terminology on development, because, the downtown Tempe area was very ripe for development during this period of time that I'm talking about. It got to the point where the developers themselves were coming in and presenting their projects to the group. Instead of like hosting a charrette that, the citywide would come to give comments, the developers were coming, and it gave the residents a lot more confidence and input into how their neighborhoods are going to look. And the residents weren't anti-development. They just wanted development that worked for them. So on a couple of projects that I saw presented, the developer walked out with a different parking structure. They walked out with a different egress and exit structure. They also walked out with like a different facade than what they were going to propose, because they had gotten this kind of input from the residents. So, these developers were again, they were the friendlier ones. They weren't the arrogant ones. And the fact that this structure existed in the community for them to go to, it was very, very advantageous for the developers that did come in and work with the community. So I've seen some of this happen.
I have a follow-up question for Chris first, and then Javier, I would love to hear if you have any thoughts on this. But from what you were saying, Chris, it sounds like the City of Roanoke, the Planning Commission, or the City Council really values community engagement. And as you were saying, that if a developer doesn't do their due diligence to involve community members in the planning and decision making, that doesn't bode well with the City Council or the Planning Commission. I'm just wondering how those values in the city have been reinforced, and what are the mechanisms that the city has used to reinforce them, either in writing or through other conversations or other things. I'm just wondering if you thought about that or if that has ever come up.
It's real, and I started working with the city in the neighborhood office in 1993, and by the time I had arrived and working for the city, it was fully embedded in the culture, and from the city manager on down, and through city council, it's something that has certainly kept me in this organization, and because it's something I value. It's just been there. It's been a way of doing things, and I've seen the benefit. And I've personally and professionally throughout my career here tried to reinforce it and do what I can to basically be one that carries out those values of engagement and involving the community in decision making. Again, going back to a democratic principle of many being involved in the decisions that are going to affect their lives. So it's just been I've benefited from it. It's something that I've tried to cultivate even more, but it's just I've got lucky, and I'm in an organization that has always valued, or a community that's always valued that.
Mm-hmm. Yeah, I think there's a lot to be said for cultural norms, as you said, and establishing values and being vocal and explicit about those values.
Well, and if I could just add that, going back to the urban renewal days, that was the complete opposite of all that, and I think the pendulum, fortunately, swings back to the opposite direction in a good way. From not listening at all to really having a meaningful engagement. I think that's where it needs to be, and it just stayed there.
Yeah. Javier, did you have any thoughts?
No, I think I'm not. One thing that you can do is and I see this in our city. I live in Berkeley. There are some things, some policies that can be passed to make sure that the word on development, they have thresholds. If your development's over a certain amount or a certain amount of change, that you actually have to, one, send notes to neighbors, but two, you have to put a sign on the front of the property explaining the changes that are going to happen. And I'm sure other places have this too, but that is a way to invite participation as well. So there are some structures that can be put in place to help folks who may not be inclined to dig, to find out what's going on, to be able to understand what's going on and a little bit easier.
Thank you. And I think we're going to have time for one more question. And I wanted to go back to a question that was posed to us through the chat box. And the question is, what is the role of the federal government as grant or policymakers in advancing community-driven public health solutions? And I would probably expand this question a little bit in terms of what is the role of grant makers and funders in advancing this work. And there may be grant makers and funders on the webinar here that may be interested in hearing about how they could further support community engagement and civic engagement. Chris, do you have any thoughts?
I'm sorry. I think you kind of went out there for a second. Could you just repeat the question, please?
Oh, sure. Yeah. Sorry about that. The question is, what is the role of federal government as grant makers or policy makers in advancing community-driven public health solutions? And I would probably expand that question to talk about all grant makers or funders of local governments or communities for them to support this work. And I don't know if you have any thoughts for funders in general. I think one of the questions that we have that's a theme throughout this is that there is a lack of resources to fund and sustain community engagement efforts. So what do you think the the role of funders could be, either private or public funders, in supporting this type of work?
Well, I think that when you get to the funding part, you're a little too far into it to try to back up, and you really are implementing something, hopefully, that you've already thought out and have engaged citizens in planning, whether it be a facility, whether it be a program, or whatever the case may be, and then you need the money to make it happen. So I think the engagement piece has to go out in front of the funding, and I do think that some flexibility with working throughout your community and doing a comprehensive plan. HUD funding rules kind of limit you to certain parts of the city, and when you're talking about funding for planning, I think that they could be a little bit more flexible on that front. That would be my only ask as far as that goes. But again, you're really wanting to use that as an implementation tool, the funding, to put something that you've already planned and engage people with.
The question was also about funding community engagement itself, and not just the planning process or even development or developments. Javier, did you have any thoughts about funding community engagement work?
Yeah, and so I think that often we professionals, the professional class, and I'll use public health as an example, public health does a number of really important things, surveillance, research, development of best practices, implementation of best practices. I'm not capturing them all. Legislative advocacy. And we do all of this in service to, building better health. And I think that, we tend to go to where we're comfortable. Our lens for solutions may not be as expansive. I mean, if you go to the CDC website again to look at, all the different domains that public health works in, you'll see that developing partnerships with communities and community engagement is actually part of it. And so the opening's there, but I feel that sometimes when we don't have strong relationships, we tend to think of solutions that reflect, where we're comfortable. And so one of the things that I'd like to see is, like, one, I'm always trying to make the argument that we aren't going to get to true health equity, health justice, unless we engage those folks that have unique concerns. And so we need to be open to expanding our notion of best practices and evidence-based practices or evidence-based programs to look at emerging practices that also need to be supported. Because in a lot of the communities that we work in and we have partners with, I should say, these are communities where the market has failed them, and even government has failed them. But some organic solutions have emerged, and so I think being a little bit more expansive about what's fundable is important. Another thing is that the way we measure this also needs to be reevaluated, because the way you measure traditional initiatives versus emergent initiatives, especially ones that originate from within the community, there are differences that need to be accounted for.
Thank you so much. And with that, we are going to close out this webinar. Thank you, Javier and Chris, for your contributions. I really appreciated your presentations and our discussion. This was the final episode of the Building Healthy, Equitable Communities series. If you enjoyed what you saw, consider checking out some of the other episodes in our series, and you can do so by visiting the URL up on the screen. I also wanted to pass along a few resources for additional reading. To gain a deeper understanding of inclusive civic engagement, check out the Kirwan Institute's Principles for Equitable and Inclusive Civic Engagement, a Guide to Transformative Change. New America's policy paper entitled Centering the Margins, a Framework for Equitable and Inclusive Social Policy, discusses an innovative framework for centering social policies on the communities experiencing chronic disinvestment and marginalization, using the principles and methodologies of human-centered design. For guidance on community engagement or multi-sector collaboration, I would point you to ChangeLab Solutions, Changemakers Guide, or our Health and All Policies resources. Lastly, please stay tuned for the Blueprint for Collective Action. That will be a guide that we will be releasing at the end of this series that focuses on how communities can address health inequities. And if you don't happen to see what you're looking for, please reach out to us for technical assistance. We may be able to help. Feel free to get in touch and share your questions or comments with us. As soon as this webinar ends, you'll be directed to a very quick follow-up survey. Please take just 2 or 3 minutes to share your feedback with us and help shape this conversation. And the recording for this webinar and expert panel will be available soon. You'll receive a follow-up email. Thank you so much for everyone for joining us.